A nurse who observes absence of P waves and fibrillating waves before each QRS complex on the cardiac monitor will interpret the client's cardiac rhythm as Option A. Sinus tachycardia. Option B. Ventricular fibrillation. Option C. Ventricular tachycardia. Option D. Atrial fibrillation. The correct answer is option D. Atrial fibrillation. In sinus tachycardia, the rate is more than 100 beats per minute. Rhythm is regular. P wave precedes every QRS complex. PR interval is normal and QRS complex also normal. Ventricular tachycardia or VT, the rate is more than 100 beats per minute. Rhythm is regular or irregular. The P wave is buried with QRS complex. PR interval is not measurable because P wave is buried with QRS complex. The QRS complex is wide or bizarre. Ventricular fibrillation or VF rate is unmeasurable, rhythm is chaotic or irregular, P wave not seen, no PR interval and no QRS complex. Ventricular fibrillation due to multiple foci firing simultaneously in ventricle and depolarizing them irregularly and without organized pattern. Ventricles are not contract. Atrial fibrillation is extremely rapid and disorganized pattern of depolarization in the atria. Causes of atrial fibrillation are cardiac myopathy, pulmonary disease, myocardial infarction, rheumatic heart disease, congenital heart disease, and post-cardiac surgery. ECG characteristics of atrial fibrillation. The atrial rate is 400 to 600 beats per minute. Ventricular rate is 160 to 200 beats per minute. The treated atrial fibrillation, the ventricular rate is 60 to 100 beats per minute. The rhythm is irregular. P wave is not present. The irregular waves are seen. PR interval is not measurable because there is no P waves. QRS complex is normal.